Know your code. You are going to start to hear a lot of discussions around ICD-10 codes. This is an extremely exciting time for ALSP and other rare leukodystrophies. We will get to that, but first let's talk about what is an ICD-10 code. ICD is short for the International Statistical Classification of Diseases and Related Health Problems. Globally, it's the go-to classification system in healthcare, used by government bodies and researchers for monitoring and reporting various health issues, from diseases to injuries. You may be wondering, why do we need a code for ALSP? Well, codes are used globally to collect and analyze data for specific diseases. Data ensures patients are receiving the best care for specific diseases, and codes are used to ensure prompt insurance approval and payment. Insurance companies use these codes to help determine coverage for interventions provided, and the codes also make it into large databases, but without personal patient information, such as your name or contact information, to protect your privacy. These large databases allow researchers to search the data to answer various health-related research questions. ICD-10 is used by the United States and 150 additional countries. Let me give you an example. A patient is seen at the hospital. The staff at the hospital enters several codes into the patient's medical record for billing purposes, such as a code for the ER visit, CBC with differential, blood cultures, blood pressure monitoring. But no code for ALSP because prior to October 1st, 2023, there wasn't a code. Possibly they entered Alzheimer's, dementia, code for those diseases, which we know doesn't help ALSP patients. Here's another example. A researcher wants to perform a scientific review of how often ALSP patients visit the ER. Without an ICD-10 code specific to ALSP, the researcher can only search the databases for the symptoms and interventions as they were coded. Once the code for ALSP goes into effect on October 1st, 2023, a researcher will be easily able to find data for their research on ALSP. It is important to acknowledge that given the importance of ICD codes, the process for updating codes is evidence-based and thorough. Those who oversee the coding system must balance the needs of individuals and organizations seeking to revise codes with the integrity of the coding system. The path to obtaining a new code for a previously unclassified disorder involves a long and challenging process. In the US, the CDC's ICD-10 Coordination and Maintenance Committee selects proposals to be presented only twice a year. Did you know previously there were only 6 codes for all leukodystrophies? Recently, 30 codes were requested, but the committee agreed to 12 of the highest impact codes. There are still over 100 codes needed for leukodystrophy. This is a big win for ALSP and our community, along with other rare leukodystrophies. And a huge thank you has to go out to Dr. Bonkowski at the University of Utah for including ALSP in the final revisions and for taking on this project for all of those affected by rare leukodystrophies. Now, it's your part. We all play a role in raising awareness. I need you to start informing the medical community, your physicians, and other families. Do your part. Know your code. G93.44 for ALSP.